Doctor's orders, vital signs, height and weight have been checked prior to me entering the room.
Come in.
Hi, my name is Valerie. I'm a student nurse from TSC, and today we will be performing a head-to-toe assessment. Can I have your name and date of birth?
Joy Desert Perez, June 3rd, 1993.
Hi, Ms. Bettis. How are you doing today?
Good.
Okay. Would you like to go to the restroom before we get started?
Just do it.
Do you prefer this assessment to be conducted in English or in Spanish?
In English.
Okay, and do you know where we are today?
The hospital.
Okay, and what will we be doing here?
I had to tell assessment.
Okay, and do you know what month we are in?
May.
Okay, on a scale of 0 through 10, 0 being no pain and 10 being
0.
unbearable, are you coming in with any pain?
No.
Okay, do you suffer from any allergies?
No.
Do you use any long-term medications, any recreational drugs, chew or smoke tobacco, or drink excessive amount of alcohol?
No.
Have you had any previous surgeries or traumas?
No.
Okay, do you have any family history, or do you yourself experience any chronic diseases such as diabetes, heart conditions, kidney problems, COPD?
No.
No. Are you exposed to chemicals, or are you frequently exposed to radiations?
No.
Where do you work, ma'am?
And rehab.
Okay, and at this point, I would make sure that my patient is alone. Have you been emotionally, sexually, mentally, or physically abused?
No.
Do you feel threatened by anyone? Okay, so we are going to get started with the physical part of the assessment, and I will be assessing your scalp. I am just looking for any infestations, any signs of alopecia. Do you experience frequent dizziness, headaches?
No.
Have you had any injuries to your head lately?
No.
Okay, and there is no signs of infestation, alopecia. Do you feel any pain or tenderness?
No.
Okay, so moving on to your temporal pulse, I will be feeling for that, which it is present. 2+, and open and close your mouth for me, please. And your temporal mandibular joint has no cracking or grating, was noted. I am going to be palpating your sinuses, and just let me know if you have any pain or tenderness here.
No.
No pain or tenderness there either. Okay. I do notice that her face is symmetrical with the rest of her body. There is no signs of jaundice or cyanosis so far. Her sclera is white. The eyelids do not go past her pupils. And look up for me. Her conjunctiva is nice and pink. There's no drainage to her eyes. I am going to have you look at the wall behind me, then look at my pen. Go ahead and follow my pen without moving your head. Okay, and keep following my pen. Okay, good. I am going to dim the lights to check your pupil, the reaction of your pupils. They should constrict. So go ahead and look at my nose. Okay, thank you. Okay, so from a 5 to a 3. Okay. Moving down to your nose, have you noticed any trouble breathing through your nose?
No.
No? Okay, so I am going to be inspecting your nose. So if you could go ahead and tilt your head up. I don't see no obstructions, no polyps. There's no drainage to her nose. The septum is not deviated. Do you experience any bleeding to your nose?
No.
Okay, so I'm going to have you occlude one nostril, breathe in and breathe out, and opposite, breathe in and breathe out. Okay, I have a cotton ball here with a scent. If you could just close your eyes and tell me what you smell.
Vanilla.
Good. My cotton ball did have a vanilla smell to it. You can go ahead and open your eyes. I am now inspecting her lips. Her lips do look nice and hydrated, nice and pink. No chapping to the lips, no sores. Can you go ahead and squint your eyes real quick for me, real tight? Open them. Go ahead and smile, frown, puff out your cheeks for me, and raise your eyebrows. Good. Now go ahead and open your mouth for me. Okay. And I am just going to be inspecting the gums, your gums, to see if there is any lesion, swelling, redness. Okay, all your teeth are present. There is no chipping of her teeth. And go ahead and lift up your tongue for me. There is no unusual masses there. Go ahead and stick out your tongue, wiggle it side to side. There's no thrush in her tongue. Go ahead and open up your mouth. Her uvula is midline, and go ahead. Okay, her gag reflex is present. Okay, moving on to her ears. I am going to be inspecting the characteristics of her ears, skin integrity, any little nodules or bumps, masses. Do you feel any pain or tenderness here?
No.
Have you had any ringing of your ears or anything?
No.
Go ahead and cover one ear. I am going to whisper 2 words and just tell me what I whispered to you.
Apples, bananas.
Good. And the other one?
Cats, dogs.
Okay, and that was good. I am going to have you close your eyes. We are going to perform a sensory test, and this you're just going to tell me wherever you feel the wisp of my cotton ball. Okay, good, like that. So go ahead. Good. Now we're going to perform a similar test, but this time you're going to tell me if you feel the sharp or the dull side. And just go ahead and point. So, is that sharp or dull?
Oh, sharp. Sharp.
Okay.
Dull. Dull. Sharp.
Okay, and last one.
Sharp.
Good. Okay, so I am going to be palpating your lymph node. So we have the preauricular lymph node, and we're just checking if there's any swelling. Postauricular, we have the occipitals back here, the submandibular, sublingual, and submental. I don't feel any swelling so far. We have the jugular chain and into the supraclavicular lymph nodes. Sorry. Okay, since I'm already here, I'm just going to be assessing your skin turgor, which was probably fine. Okay, have you noticed any difference eating, swallowing, any trouble while
No.
drinking water? Okay, I am going to be inspecting the trachea. It is midlined. Go ahead and raise your head for me real quick. Okay, so I am going to be palpating. I don't see any quarters. Do you feel any pain or tenderness here?
No.
Okay, go ahead and turn to your left for me. There is no jugular vein distension, and there's no jugular vein distension on either side. I am going to be palpating the carotid artery, which is strong and bound bilaterally. I would also listen to the carotid artery. So take a deep breath in and out for me and hold. Hold. Good. The other side, take a deep breath in and out for me and you hold. Okay, and I am just listening for any breeze, which I don't hear none. Okay, so we are going to perform some range of motions to the upper extremities. So go ahead and look up for me, down, side, other side, ear to shoulder, ear to shoulder. Do you have any pain while doing any of that?
No.
Okay, go ahead and turn your face to me. I'm going to apply some resistance. Okay, you did that with ease. Go ahead and shrug your shoulders for me. Put them down. Shrug them again. Put them down. Good. Do you have any pain?
No.
While I'm palpating? Okay, I don't feel no any nodules or any masses here. Her capillary refills are less than 3 seconds, and we are going to be performing some range of motions to your arms. So if you could just flex, I'm going to push against my hands. Okay, pull against my hands. Good. Go ahead and put your hands down, up. Just spread out your fingers and just go ahead and put each digit to your thumb. Good. Okay, so you can put your hands down. Okay, so moving on to the chest. I am going to be inspecting the thorax to see if she has any labored breathing, if she's using any accessory muscles. Have you noticed a difference in your breathing patterns lately?
No.
Okay, do you exercise frequently?
No.
Okay, so go ahead and turn around for me, please. Okay, and I am just going to be inspecting her posterior thorax. I don't notice any lumps, masses, or bulges. Do you have any pain or tenderness here?
No.
Okay, I am going to be checking the expansion of her lungs. So go ahead and take a deep breath in for me and out. Okay, so good. I am also going to be palpating the kidney. So go ahead and let me know if you feel any pain or tenderness here.
No.
And then other side.
No.
Okay, I will now be auscultating your lungs. So go ahead and give yourself a hug just to remove the scapulas out of your way. Okay, take a deep breath in and out, and I will be listening to 10 different parts of your lungs. Okay, so go ahead and turn it to the left or right, whichever you prefer. Okay, so this is your left side, so go ahead and raise your arm for me. and I am seeing the retraction or the bulging of the intercostal spaces. Do you feel any pain or tenderness here?
No.
Okay, I will be auscultating 2 parts. Okay, good. Go ahead and turn to the right side, and we will be doing the same thing. I am looking for any bulging or retraction, excessive retraction of the intercostal spaces. Do you feel any pain or tenderness?
No.
Okay. I will be auscultating 3 parts of the lung. Good. So go ahead and face forward for me. Thank you. And I will be palpating to begin with. Let me know if you feel any pain or tenderness here. Okay. And I will be auscultating as well. So above the clavicle, in and out. I am listening for complete breath sounds in all 8 spaces here in the anterior thorax. Okay, good. Moving on to the chest, you did mention that you don't suffer from any hypertension or heart problems, right? Okay, so we are going to be auscultating the heart. I would palpate the point of maximal impulse for a complete minute to get your pulse, and then I will start auscultating the mitral, which would be from the suprasternal notch down 5 intercostal spaces. 4, 5. Okay, midclavicular to the left. Okay, and I would listen to the diaphragm, then from the clavicle to the suprasternal notch down 2 intercostal spaces to the right. I have the aortic, and then I have the pulmonic right across. Erb's point, tricuspid, and again the mitral down here. Okay, I would do the same with the bell of my stethoscope to listen for any bruits or murmurs. I am going to be feeling for the brachial pulse, the ulnar, the radial. Okay, and then we got the popliteal down here, the tibial pulse, and then we have the dorsalis pedis, and they are all strong and bound bilaterally. So we are now going to be assessing, actually before we move, I am going to be assessing the costovertebral angle in the front as well. So go ahead and take a deep breath in for me, and this is also just to check the expansion of your lungs in the interior side. So that was good. Go ahead and lay down for me, ma'am. Okay, I am going to be checking your abdomen. So have you been suffering from any unusual cramping out of your normal menstrual periods? And when was the last time you had a menstrual period, ma'am?
Last one.
Okay, I am going to start by auscultating all 4 quadrants of your abdomen. And we are going to start in the right lower quadrant. Okay, so I am just going to be listening for bowel sounds for 5 to 20 seconds in each quadrant. If the bowel sounds were absent, I would listen for a complete minute. Okay, since I'm already auscultating, I am also going to auscultate the abdominal aorta up here. Okay, so your bowel sounds were present. So now I will be palpating. Just let me know if you feel any pain or tenderness anywhere. No, nowhere, no pain or tenderness.
No.
I also noticed that there was no distensions prior to me auscultating, so I will now be percussing. And tympanic sounds are normal. Okay, so I am going to be palpating your bladder. Let me know if you have any pain or tenderness here. You might feel the need to void, but that is normal. No pain or tenderness?
No.
Okay. We're going to go ahead and put your shirt down. So we are going to move down to the genitalia part of the assessment. I am going to place you in a dorsal recumbent position, which would have your knees bent right here. I will ask you if have you had any unusual bleeding to your rectum or vagina?
No.
Okay, do you experience any changes in your bowel movements?
No.
How often do you go to the restroom?
Nobody.
Bowel movements. Okay, so once a day. Do you frequently drink water? And do you incorporate a good amounts of vegetables and fruits in your diet?
Yes.
Okay, so I am going to expand the labia majora. I am looking to see if there is any lesions, any unusual drainage. If there is an unusual drainage, I would grab a culture and have it on the side to send to the lab. I am also looking if there is pubic hairs. I would be looking for any infestations, any masses or redness, swelling. Okay, so now for the rectum, I am looking for the same thing, any swelling, any redness, any masses, any hemorrhoids, any signs of force of entry to either or. Okay, so we are done with your genitalia, ma'am. Thank you for your cooperation. So I am going to perform a range of motion. So first of all, I'm going to check if you have edema on either legs. So there's no sign of edema. So I am going to perform a range of motion. Have you had any trouble, weakness to your legs, extremities? No? Okay, so I am going to start by going up to the side, abduct, adduct. We're going to bend the knee. Okay, no pain or tenderness, ma'am?
No.
Okay, so that was one. I didn't feel no popping or anything. So then for the right side, the same thing. I am going to be performing range of motion. Okay, the hips. Okay, moving down to your feet. I am going to be flexing your foot, pointing your foot, inversion, eversion. Now your little toes up. Okay. Again, flex, point, inversion, eversion, toes. Capillary refills are less than 3 seconds as well. You can go ahead and sit down, I think. Okay, so now we are going to perform a test that is called the get up and go. So this test just requires you to get up without no assistance. You're going to walk a couple of steps forward and okay, you can go ahead and start, ma'am. We're just checking to see your balance. Go ahead and turn around. Okay, and you did that pretty good. Okay, I'm going to have you stand up one more time, and I'm going to have you turn around. Well, let me just inspect right here. So there is no signs of kyphosis or lordosis. So I'm going to have you turn around, ma'am, and bend forward. Just touch your toes. Good. Her spine seems to be symmetrical. Do you have any pain or tenderness?
No.
And there is no signs of scoliosis. Go ahead and stand up. Okay, and just you're going to stay standing. Close your eyes for me, and we're just going to perform the Romberg's test, which would be 20 to 30 seconds. Okay, and there is no swing or abnormal movements there, so you can go ahead and sit down, ma'am. Okay, so this does conclude our head to toe assessment. Do you have any questions for me?
Not at the moment.
Okay, so I will go ahead and let the doctor know that we are finished here, and he can come in and talk with you.
Thank you.
Thank you.